Hi, I just wanted to come on here today and provide a little bit of insight about what a hormone consult can look like and what all it entails. So, first, when you contact us, we will find out a way to obtain some lab work. We will either send the lab orders over to a lab to have your blood drawn, and then we'll have the results prior to the consultation visit. So we'll be able to review those labs together during our visit. We also have the opportunity to send our nurses out to you or to come into office to obtain that blood work. And in theory, we like to get it beforehand, and that way, when you and I are going through the consultation, we already have those labs that we can discuss. And so we take several things into consideration: your lab work, the symptoms that you're having, as well as personal demographics, height, weight, ethnicity, activity level. Are you a chronic pain patient? Do you take any medication for ADD? Have you ever had any breast cancer? Have you had your PSA checked in the case of male patients? Females, we check and make sure that mammograms are up to date. And then we kind of will talk through the different hormones and what their place can be in helping us to get optimized. Is your libido low? Are your moods and anxiety and depression and irritability, are all of those things coming into play? That could be testosterone related. Oftentimes for females who are having hot flashes, night sweats, and sometimes urovaginal changes, that can be an estradiol deficiency. And progesterone is usually a part of a female's workup as well. That's really helpful for sleep, and also another one of those good mood medications that helps you feel your best. And then with your lab work and all of that demographic information, we can determine where there are any deficits, and where we can improve on these symptoms and improve the lab values as well. So then we'll go over the different modalities. We have oral options, we have topical options, creams, patches. We have oral troches. It's kind of like a lozenge that sits in your cheek and it dissolves that way. We also have injectable options, and then pellets as well. So we can talk about all those different modalities and what you're comfortable with, and we'll just go from there. Consults are very important to kind of getting a baseline of why do we think we need to address hormones, and how does the lab work support that. And we've got a great plan in place and a great team so that we can help you feel your best.